Start things off. Originally, when I proposed to do this fellowship, I had proposed to chart some of the changing medical practices between the War of 1812 and the Second World War. Now, this is an era of considerable change in medicine. Lots of alterations in surgical techniques, technological change, organizational, cultural. But I found that of all of these changes over the space of 135 years, one of the most important ones was in how disease was managed in wartime. And really this goes beyond important. Warfare today looks absolutely nothing like it did 200 years ago, not just because of the changes in technology and tactics and strategy, but first and foremost, I think, because of new methods of disease prevention that have absolutely revolutionized the way that war is conducted and the way that disease and health is understood. Now, today, acute wound and disease treatment has never been better. In field operations today in places like Afghanistan, we can probably save 99% of the sick or wounded soldiers who make it alive into a field hospital. And this is absolutely fantastic for saving lives. The doctors deserve a great deal of credit, and the entire medical apparatus is absolutely top-notch. But the Army's concern is also about saving manpower as well as saving lives in acute situations. When 50% of a military force becomes casualties to infectious disease, and as you can see, historically this would be actually a very low number, then the question of treating them is moot in comparison to the question of how to prevent them from getting sick in the first place. Now, before the advent of modern public health and preventive medicine, these traits, all these traits meant that armies were absolutely ravaged by disease. They were overcrowding, poor hygiene and sanitation, the fact that armies would carry disease into, or would carry their own microbes into unfamiliar disease environments, made them the perfect vectors for transmitting disease and for becoming sick themselves. The First World War was the first major conflict in history in which more soldiers died in battle than died of disease. Prior to 1914, it was entirely routine for at least 5 times as many deaths to occur from disease as occurred from combat, as you can see from some of the numbers I've thrown up on the screen. In the American Revolutionary War, or in the War of 1812, a soldier stood a much better chance of living through a battle and facing enemy fire than he did of spending a few days or a few weeks in a friendly hospital. It's absolutely true. Until the 20th century, war was always a highly mobile military catastrophe waiting to happen. So one of tonight's themes is that today's military forces are just as vulnerable to disease as those of the 18th century were. And that if public health measures are not consistently applied to protect that force, then medical disasters, just like those historically, can still occur to forces today. Now, I think one of the best ways to gauge the importance and effect of preventive medicine is by way of historical comparison. Now, there's 2 events in military history that really stood out to me for analysis because they took place on the same ground at the same time of year with very similar seasonal, environmental, and microbial factors, 135 years apart. These were the Walcheren Campaign of 1809 during the Napoleonic Wars and the Scheldt Campaign of 1944 during the Second World War. Both of them took place in the Scheldt River estuary of the southern Netherlands during the late summer and autumn of their respective years. But where the 1809 Walcheren Expedition was one of the most horrifying examples of unchecked disease on a military force in history, the 1944 campaign was an absolutely sterling example of the effectiveness of preventive medicine in action. I want to give a little bit of geographic background because I don't think it's necessarily all that well known. This is the Scheldt estuary in the southern Netherlands. It's been settled as far back as Roman times and is really one of the gateways to northwest Europe. It was the Scheldt River, which starts in the North Sea, snakes inland through the Netherlands, to the southern Netherlands, and to the Belgian port of Antwerp, which has historically been one of the largest ports in Europe. The Walcheren Island it's not an island anymore, but Walcheren is kind of the cork in the bottle of the Scheldt River, if you will, there. South Beveland, the isthmus there that connects it to the mainland is also important for some of the stories. But it has a commanding position on the Scheldt River and is very strategically important, just given the sheer amount of shipping traffic that goes up and down the Scheldt River at any given time. So, as I said, it used to be an island, but much of the estuary is actually reclaimed land. And through dikes and polders and elaborate irrigation works over the last 200 years, they have actually managed to reclaim much of the coastal areas here, most of the South Beveland and Walcheren, from the sea. This means that, well, for one thing, it is extremely productive, rich irrigation, rich agricultural land. But it's also one of the perfect breeding grounds for infectious diseases because it has created swamplands, some subsoil reservoirs, dikes and polders with lots of standing water in the area. Now, Walcheren in 1809, probably one of the least celebrated military campaigns of the Napoleonic Wars, and with good reason. Now, just for a really quick background, the Napoleonic Wars in 1809, France controlled all of most of continental Europe. So much of continental Europe that it certainly had a monopoly on power there. Britain remained defiant and controlled most of the ocean lanes. But you had two enemies that had a difficult time coming to grips with one another. The British were fighting them in Spain and Portugal at that point. And the French were conducting campaigns in Austria, but Britain had the advantage of being able to project its force overseas, and because they controlled the seaways. So, in 1809, combined with the news of an Austrian victory over France in the month of May, the decision was made by the British government to launch an expeditionary force of about 40,000 soldiers and a large naval squadron to land on Walcheren Island and South Beveland, and then to march inland and sail down the Scheldt River to capture Antwerp and deprive Napoleon of one of his prize ports and much of what was left of his fleet at that point. This was a bold plan that was bogged down by sloth, and months passed with only minimal preparation and very desultory organization that went on in Britain. By the time the expedition had actually been launched, Austria had already been defeated and signed a separate peace with France. So the strategic objective for which the main Walcheren expeditions had mainly been intended, which was to relieve pressure on Austria, was already a moot point. But preparations were at such an advanced stage that they decided to go ahead anyway. So the cross-channel invasion went ahead, and the landings began on the 30th of July, 1809. It gets much worse. It gets much worse. Initially, they did very well, though. The landings on Walcheren were successful. The French were defeated. The French held port of Flushing on the south coast of Walcheren Island was besieged. There's a painting from the time period showing the bombardment and siege of Flushing, and surrendered on August the 15th. The British effectively closed down the river. There were 7,500 French prisoners of war, many others killed. Port of Flushing largely destroyed by the sustained bombardment. Only 700 British soldiers were wounded, and only approximately 100 died. So this had all the makings of a really stunning victory for the British if they turned around and left at that point. But they didn't. The British force was paralyzed by indecision and procrastination, and by the end of August, they still had not pushed any further or closer towards Antwerp. The French had reinforced their fortresses there. Morale was beginning to sag, and the French made no counterattack against the British in the Scheldt because, well, they simply wanted to wait. Napoleon and his generals were students of history, and they knew something that the British appeared to have forgotten, which was that the Scheldt is an extraordinarily unhealthy country at this time. It was a graveyard of armies and had been for over a century, not because of combat, not because of military action, but from disease. And sure enough, at the end of August, a deadly epidemic began to sweep through Walcheren Island. The troops called it Walcheren fever. Spread very fast. At the midpoint of the month, there were only a handful of sick troops in the entire British expedition. By the end of August, there were 3,400 British soldiers listed as sick. By October, there were almost 10,000 sick still in Walcheren, not including the ones who had already died, who were, as we'll get to in a moment, were legioned. At its height, 3/5 of the British force was reported as being in hospital on the island. The dead were so many that they had to start digging mass graves. To prevent panic, the burials had to take place after sunset and before sunrise, without candles or torches, so that the troops would not have to see their comrades being shoveled into mass graves. Military bands and honor guards were discontinued as deeply impractical under the circumstances, to say the least. So what was Walcheren fever? Well, it involved distinctive kinds of fever, a remitting fever and a more sustained one. Red spots on a victim's chest, stomach, and extremities, headache, muscle pain, diarrhea. Post-mortem examinations showed enlarged spleens resembling, quote, a mass of coagulated blood. The duration was lengthy. Relapses were happening among relapses were happening among infected troops for over a year afterwards. There was a fatality rate just in 1809 during the campaign of between 10 and approximately 20%. Now, historians now accept that Walcheren fever was not actually a new type of disease. It was really a lethal combination of existing diseases. Typhus, typhoid fever, paratyphoid, malaria, and dysentery are the main culprits. We can't know for sure, but given what we know about military camp diseases from the time period, and given what the evidence and the rather substantial medical records that we now have say, we can pretty much narrow it down to this being a really unfortunate combination of endemic malaria in the region and many of the more common camp diseases. This is really the perfect ground for these diseases to flourish. Hygiene and sanitation on Walcheren ranged from terrible to absolutely non-existent. Now, the human suffering is really difficult to capture 200 years later. Soldiers lived in constant fear and uncomprehending apprehension about what was going on around them. It's not like today when we really know the causes of disease. A lot still remained theoretical and a matter of hearsay, and it was not accessible to the common soldier in 1809. Everyone was sick, especially the surgeons and the physicians. The flooded countryside meant that everything and everybody was soaked constantly. Shelters and dwellings as they existed had been destroyed in the fighting for the most part, so improvised structures were needed, but it was impossible to keep anyone dry or warm. Now, the British persistently hung on to Walcheren for months in order to deny the Scheldt River to Napoleon. But they finally withdrew their last garrison troops in December of 1809. By the time they had withdrawn, 4,000 soldiers had died of disease. Even more would perish in Britain over the coming months. Virtually the entire rest of the expeditionary force had fallen ill and been incapacitated. For every one soldier who was killed in combat on Walcheren Island, there were 37 who died of disease. This is still cited in historical literature as one of the greatest medical disasters in military history. Now, the bad situation on Walcheren was really turned into a catastrophe, not just because of the unfortunate disease vectors, but really by medical mismanagement and the failure to adhere to the military's own best practices from the time period. In the mid-18th century, there was a British military physician named Dr. John Pringle, who wrote a book called Observations on the Diseases of the Army, based on his own experiences on campaign in the Scheldt estuary in the middle of the 18th century, so about 60 years before 1809. This book contains most of the principles and recommended preventative medical practices of the present day, except those that are explicitly based upon microbial germ theory. It contains rules for soldiers' personal hygiene, ventilation of barracks and accommodations, proper clothing, avoidance of overcrowding, the dangers of heat, cold, excessive fatigue, wetness, strict sanitary codes involving waste disposal, the careful construction of latrines, quarantine of the sick, selection of campsites, policing of all of these policies for violators, close attention to rations and drinking water, including orders to boil water before drinking it. And this is before germ theory. This is entirely based upon what could be deduced from trial and error. The key was that for John Pringle, responsibility for force health protection in a military situation fell to the military commanders, not to the medical officers. Left to their own devices, soldiers would ignore and neglect preventative practices. They had to be made to comply with them for the good of the overall military force. Now, Pringle and his comrades and many of his disciples, if you will, over the next decades, established medical practices that were used intermittently by the British over the next 60 years. Pringle was required reading by medical personnel, but was not actually widely read by many of the commanding officers and the rest of the army. There were a few. There's been some good studies on what British officers of the time period were reading and looking at during the 18th century. And Pringle mostly shows up in the libraries of medical officers. One of the problems was that physicians and surgeons in the army were still seen as outsiders. They held rank as lieutenants, as captains, as majors, but it was largely ceremonial. They actually had no ability to exercise that rank. They were gradually of very low status in the pecking order of the military. They had very few opportunities for promotion and advancement for practitioners in the army, which meant that sometimes you weren't even getting the best individuals who were in these positions. Not always. There were many skilled physicians and regimental surgeons, but unfortunately their prospects for advancement beyond their station were always a little bit limited. But Pringle's medical wisdom passed in and out of vogue. Some, like General James Wolfe during the conquest of New France, paid fastidious attention to hygiene and sanitation matters. But he was often mocked for that, as we can see here, as being beneath an officer's dignity. This is a caricature drawn of James Wolfe on the left there by one of his senior staff officers on campaign in 1759. It was then circulated around the officers' mess for a joke. It reads, General Wolfe says to the habitant who is digging, what depth is that latrine there? The habitant replies, 25 feet, Mr. General. And Wolfe says, what? An inch per man? Not enough. We shall be engulfed by the first discharge. Keep digging. We'll see another one of these a little bit later in the talk. Now, the downfall of the Walcheren Expedition was that very few of the established best practices were actually adhered to. It was hard to detect. It was really hard to detect any prior influence of John Pringle and the hygienists during this campaign. So what happened at Walcheren was not only atypical of the early 19th century, it was actually a throwback to the early 18th century. So in terms of the medical mismanagement that happened in Walcheren, it was really no secret at the time that the Scheldt estuary was a hotbed for disease. But no physicians were consulted or special medical preparation were made for the expedition. The veil of secrecy was kept draped over the expeditionary force, especially concerning its intended destination, until the very last minute. That means that no doctors were involved in trying to figure out whether or not they should launch this expedition in the first place, but then what special preparations would be needed for deploying to a high-risk site like the Netherlands. Ironically, word actually leaked out to the French that the expedition was coming, so we had a situation where the enemy was better prepared to meet the Walcheren expedition than the British Army's own medical services were. Another aspect of mismanagement was the availability of medicine was in tragically short supply during the expedition. The importance of clean water at this point was well known, well established, and the water on Walcheren was badly contaminated and known to be injurious to the soldiers. Fresh water was shipped over from England, but the Army, General Officer Commanding, the force there decided to give that water to the ships of the Royal Navy that were anchored off Walcheren rather than to the troops who were dying of disease on the island. The medical staff itself was completely inadequate. They were understaffed for an expeditionary force of their size even before the disease had struck and carried off half of the practitioners. The physicians, the surgeons' mates, there was a mad scramble to try and find more of them anywhere in England at that time to relieve the expedition. Those who were there on the ground performed absolutely heroically, but in conditions that were beyond appalling, and they were ultimately fighting a losing battle. Another aspect is the policy of centralizing care in general hospitals. And this may have been necessary because of the shortage of practitioners, but it was a well-known fact that centralized hospitals were black holes of sickness and death in the 18th and 19th century. Reform-minded doctors really championed regimental hospitals and aid posts over centralized general hospitals. But 6 general hospitals were deployed on Walcheren, many more back on the beaches in Britain. Constant efforts were being made to centralize care. Why? Because 2 of the figures at the top of the War Office's medical board, and at the top of this caricature as well, pilloried, were Surgeon General Thomas Keat and Physician General Lucas Pepys. Both of them were strong believers in general hospitals. They couldn't stand the thought of lowly regimental surgeons predominating in healthcare, and having general hospitals on site allowed more high-status army physicians to be appointed in any given command. So soldiers were crammed together under horrific conditions in hospitals, allowing for considerable cross-contamination of different diseases. Now, there's a lot of political fallout from the Walcheren Campaign. Many of the soldiers from Walcheren never actually fully recovered their health. For years afterwards, as late as the Battle of Waterloo, the Duke of Wellington was raging against having to take regiments that had been at Walcheren with him on campaign, because not only were they still sickly, but they were seen to promote unhealthfulness and disease among other regiments as well. Overall, Walcheren in 1809 was an absolutely unmitigated disaster from the highest levels of government, where the scandal related to Walcheren brought down the British government, to the experience of the lowest foot soldier. It's really a cautionary tale for how poor medical planning can ruin a military force. Now, but the next time the British Empire would find itself in a desperate struggle to control the Scheldt estuary, the situation would be entirely different. Now, 130 years would go by before a large-scale war would again revisit the Scheldt. The Dutch remained neutral during the First World War, but the Netherlands were invaded and occupied by Nazi Germany in 1940, to the great detriment of that country. Over the next 4 years, the Dutch coastline and the Scheldt estuary in particular were integrated into the Germans' Atlantic Wall, an elaborate series of fortifications designed to defend the west coast of the continent against the anticipated Allied invasion from the United Kingdom. Walcheren, which at this point was no longer an island, but the land reclamation had actually attached it to South Beveland, was transformed into a giant fortress sitting at the mouth of the Scheldt. Now, once the Allies had successfully landed in Normandy on D-Day in June 1944, their greatest enemy was their own overtaxed supply lines. There's 2 million Allied soldiers who were landed in Normandy over the space of about 3 months. Hundreds of thousands of trucks, jeeps, carriers, tanks, planes, all of the parts and fuel that were necessary to keep them moving had to come in over the beach, which is a very inefficient way of doing anything logistically. Created a huge logjam. The problem was that no good ports had fallen into Allied hands yet. Most of the really good ports along the coast of northwest Europe were either still in German hands, had been extensively sabotaged, or otherwise would not be available for many, many months. So a major crisis was developing in autumn 1944. The Allied offensive was grinding to a halt just short of the German border for lack of reinforcements, lack of supplies, lack of fuel. What they really needed was a major deep-water port. What they really needed was Antwerp, Europe's second largest port at the time. So in September 1944, Antwerp falls into Allied hands without a fight, largely undamaged as well. It's a miracle. But the Germans remain dug in on the Scheldt estuary and Walcheren Island, and if they hold it because of where it is situated, because of that commanding approach there, they effectively deny the use of Antwerp to the Allies. So the all-important task of clearing the Scheldt estuary of German resistance and opening Antwerp actually ends up falling to the 1st Canadian Army, sweeping along the coast. To this point in the campaign, I won't go into details, but they've been largely relegated to areas where they're seen by the command where they can do the least, they can make the least trouble for themselves. But suddenly everything depends on them being in the right place at the right time. Now, the plan of attack is really a 4-stage one to clear the Scheldt between October 2nd and November 8th, 1944. None of the stages were easy. I won't go into too much detail, many details about the fighting. But the Germans deliberately flooded much of the estuary themselves, turning dry battlefields into the same marshy, unhygienic bogs that the British soldiers encountered in 1809. What the Germans didn't flood, the Allies did, including a massive bombing raid that destroyed many of the dams, holding the water back from Walcheren Island, which itself is flooded and almost completely destroyed by the Allies as a military tactic. During the month of operations, there were 6,300 Canadian combat casualties, dead, wounded, and captured. During the same time, the Germans suffered about twice as many, and about 40,000 Germans were captured by the Allies. But the operations were ultimately successful, and by mid-November, Antwerp was open, and the Allied supply problems slowly begin to ease. But what about disease? If anything, the conditions in the Scheldt in 1944 were even more hellishly flooded and unhygienic than they had been in 1809. But if you shall look at the numbers that were admitted to hospital with various diseases, specifically the diseases that caused the most damage, the constituents of Walcheren fever in 1809, it shows this is a very different story in the Scheldt Campaign. There were a few cases of malaria, a little bit of dysentery, virtually no typhoid, and absolutely no cases of typhus at all. There were a large number of soldiers diagnosed as sick with various diseases on any given week, but keep in mind this is for an army of almost 200,000 soldiers, so relatively speaking, very small numbers. And in the entire Scheldt Campaign, over the course of that month, there's only one soldier who actually died of disease on the ground there, a poor unlucky bugger. But Canadian hospitals were still very busy places during the Scheldt. So really, what were soldiers going to hospital for during this time? Now, the preponderance of hospitalizations in the Scheldt were combat casualties. But after battle casualties, the highest rates of hospitalization were due to gonorrhea, syphilis, and other venereal diseases. Over 40,000 cases of venereal disease were treated and hospitalized for the Canadian Army in Canada alone between 1940 and 1945. And the numbers were a little less certain for the European campaigns, but we can be quite confident that they were equally high. Even during the Scheldt Campaign, venereal disease cases seriously outnumbered hospitalization for just about any other named disease. So many of their problems, many of the problems of the Canadian Army as far as disease were concerned, were, if not self-inflicted, then at least voluntarily created. So while there was illness in 1st Canadian Army, there's really no trace at all of Walcheren fever from 1809, which is a really good thing too, because the Canadian Army in 1944 was already on the knife's edge of a major manpower crisis, just from combat casualties alone. They were one moderate epidemic away from not having enough men on the ground to actually succeed in capturing the Scheldt. And had they failed to do that, then Antwerp would not have been opened, and the Allied offensive could not have continued. So it's worth investigating what they were doing right in order to overcome many of the problems of disease that had occurred in earlier campaigns. Yeah, the real question is why. So what changed between 1809 and 1944 to produce such radically different outcomes in two campaigns, despite there being so similar in geography, in climate, and in season? One thing that we know was that it wasn't because the Walcheren fever diseases were cured. All of them were still endemic, epidemic, or potentially so in Europe in 1944. Malaria, typhus, typhoid, dysentery, paratyphoid. They were, they were held in check by advances in a new awareness in public health, which we'll discuss. But when public health measures began to break down, as they did on some other fronts during the Second World War, diseases like typhus and malaria could reassert themselves with catastrophic results. So what changed? As I said, little to do with curing or even really treating diseases. But 135 years in between these two campaigns saw a radical shift in priorities and a new understanding of the importance of disease prevention and public health. Now, the military at the time of John Pringle was at the forefront of the public health movement, which was really a renewed social focus on sanitation, hygiene, cleanliness, and public order. But the military could really rarely apply these principles consistently, as we've discussed. It was very easy for them to lapse back into bad habits while they were in the field. Now, public health measures in civil society began in England in the late 18th century with what has been called the Great Sanitary Awakening. It came at a time when there's a huge population transfer and relocation from rural to urban centers. And with that transition came really new activities, ideas, and legal powers and the administrative structures that we now associate with public health. Centralization of the civil population during the early Industrial Revolution initially led to widespread epidemics such as cholera and typhus. But because the dominant thinking in the early 19th century was that the disease had an environmental etiology, the miasma theory, the solution that was struck upon was that by improving these environments, they could decrease the incidence of disease. So they had some aspects of it wrong, but they were still doing what was necessary in order to mitigate some of the worst effects of epidemic disease. Now, so by the mid-19th century, there were vast civil engineering projects in place to improve sanitation. There's a bevy of municipal regulations in many municipalities targeting personal hygiene to prevent the spread of disease. We see sewer construction, public latrines, new emphasis on personal cleanliness, water chlorination. All of them take on a great new importance in most of Western society. Public health campaigns succeeded in changing public attitudes towards hygiene and sanitation to a very significant degree. Now, concurrent was the scientific medical revolution. The microbial causes of disease were identified around the mid-19th century. There was new awareness of why and how people became sick, led to an increased awareness of how to prevent yourself from becoming so. Developments in antisepsis and asepsis were also extremely important. How to keep certain environments, such as hospitals and food preparation areas, germ-free was extremely important. But really, the scientific medicine simply confirmed the efficacy and the wisdom of John Pringle's well-established measures in preventing the spread of infectious disease from the 18th century. Quarantines, isolation of infected individuals, concern over cleanliness of water, all of them were part of, all of them have been part of public health policies for centuries. But really, the superior knowledge of which specific microbes were involved allowed for targeted responses, and it really gave the benefit of knowing why particular measures worked, rather than simply deducing that they did. Vaccination was also something that was new and important. It began really first with the military practicing primitive vaccination techniques against smallpox in the 18th century. But by the late 19th century, it had led to the invention of a host of new vaccines that could offer partial or total immunization against many of the major diseases, epidemic diseases at the time. Smallpox, rabies, cholera, typhoid, typhus, tetanus, all of them eventually could be combated with vaccination, so that exposure no longer necessarily meant serious illness or death. They were excellent supplement to public health if people would become vaccinated. There's a great exhibit at the Museum of Healthcare that shows anti-vaccination protests, I believe in downtown Toronto, from the early 20th century that shows that some of these foolish ideas have been with us for a very long time. Now, both the infection rate and the death rate from infectious disease fell sharply in most parts of the world between 1809 and 1944 as a result of rigorous application of sanitation and hygiene, vaccination, improvement to diet, and overall living conditions. But these are all prophylactic measures. They hold deadly infectious diseases in check, but require constant diligence, hard work, and discipline in order to be effective. When these elements of diligence and discipline break down, pathogens return with a vengeance. If pesticides and repellents aren't used, then you get typhus. If hygiene measures are lax, then you get typhoid and paratyphoid, the enteric fevers. If troops refuse to take their prophylactic treatments, to use mosquito nets or to wear the proper clothing, then you get malaria. If troops refuse vaccination, then anything goes. The French army, to use an example here, in the first 9 months of the First World War, experienced 65,000 cases of typhoid fever, 11,000 of which ended up being fatal cases. The reason for this was because the French army had instituted voluntary vaccination policy that allowed troops to opt out if they so wanted to, and many of them did. and many of them came down with typhoid fever and died as a result. The Canadian Corps during the First World War, as a point of contrast, decided that they didn't want to mess around with these issues at all, and from the very beginning they instituted a policy of mandatory vaccination. And lo and behold, the Canadian Corps in the First World War suffered 422 cases of typhoid throughout the entire war, and only 16 cases ended up being fatal. So we can see that vaccinations are extremely effective in combating some of these diseases if they are made mandatory, if they have to. There's an element of discipline and leadership involved on the part of the military hierarchy, rather than just making them available to the public. Now, the Canadian Army in the Second World, back to the Canadian Army in the Second World War, and what they were doing right, more specifically. By the outbreak of the Second World War, there's really no debate that was needed about the advisability of incorporating preventative medical techniques into military medical organization. At the start of the war, there was a director of hygiene who was appointed at National Defense Headquarters in Ottawa to oversee policies of immunization and sanitation among soldiers. Qualified hygiene officers were trained at Canadian universities to administer the preventive medical apparatus that was being put together. Before Canada even declared war, field hygiene sections were created for each of the Canadian formations. Each of these sections was commanded by a medical corps officer, but was staffed with NCOs and other ranks who actually weren't from medical backgrounds. I met a man 2 weeks ago who lives here in Kingston, who was a sergeant in a field hygiene section with the British 8th Army during the war. He was a plumber before the war, and they had him working as a tinsmith with his hygiene section. But they served it goes to show they served a number of very important functions. Served as frontline sanitation inspectors, enforcers, and advisors. Also construction workers when it came down to it, in terms of constructing what was necessary to ensure that proper sanitation policies were being adhered to. They studied the state of accommodations. They rigorously tested water supplies and rations, mess hall arrangements and units, personal hygiene, ventilation, laundry, disinfestation of pests, eradication of mosquito habitats, latrine inspection. General Wolfe, pictured here inspecting latrines in 1759, was certainly approved. They carried out bacteriological and chemical analyses on samples. So the hygiene sections would notify and even reprimand commanding officers of units that lagged behind in hygiene and sanitation measures, emphasizing command responsibility to ensure that these standards were being met. They were to guard against laxness that could cause medical disaster. Vaccination was another powerful tool. Upon mobilization in 1939, Canadian troops underwent mandatory vaccination for smallpox. They received doses of the TAB vaccine, which was for typhoid and paratyphoid as well. Later on in the war, they also received a new vaccine for typhus. This sounds easy, but really organizing not just one, but a series of vaccinations and booster shots against a number of infectious diseases for 1 million Canadian soldiers overseas in Britain was a major logistical undertaking. It required a great deal of work, and it paid off handsomely. Now, the other hygiene measures involved DDT dusting. Invented in 1939, the DDT was an insecticide, saw extensive use combating malaria-carrying mosquitoes and typhus-carrying lice during the Second World War. It would be banned later in the 1960s, but in World War II, it was one of the main measures of controlling typhus in particular. Canadian soldiers would be issued personal canisters of dusting powder so that they could liberally apply it to their clothing and their possessions. And all shirts that were given to soldiers in the Scheldt Campaign were actually impregnated with a solution that involved trace amounts of DDT that remained in the fibers of the shirt that were very effective in killing lice. Field hygiene sections were also equipped with gas-driven air compression units, shown here on the right, which permitted mass DDT dusting. These were mostly useful in dusting environmental situations and prisoners of war, both German and some of later on some of the liberated prisoners from concentration camps, where typhus was particularly epidemic. Very highly effective use of DDT. Malaria was controlled with mosquito habitat destruction, mosquito netting, repellent, and the administration of anti-malarial drug mepicrine, also by command order. Now, these public health measures combined meant that Walcheren fever, the diseases that constituted Walcheren fever, effectively caused no losses to the Canadian Army in the Scheldt. All of these diseases were still major problems in the Second World War, but particularly in Northwest Europe. They accounted for a much smaller number of casualties in terms of hospitalization and deaths than ever before in history. But these diseases hadn't disappeared. I want to emphasize that. It required rigorous hygiene, sanitation, inoculation, chemical measures in order to keep all of them at bay. All of which required a great deal of buy-in on the part of the troops and the military leadership in order to be fully effective. So the Canadian Army in the Scheldt managed to achieve this considerable feat where other armies, even in the Second World War, had failed. So what can we take from this? I think quite a lot. And there's even serious implications for present-day military operations, because a lot of these lessons of public health are not unique to any given time period. Walcheren in 1809 represents really a worst-case scenario for military public health and for forced health protection. It's the intersection of camp diseases and malaria, coupled with a breakdown of the British Army's own established best practices, created a near-perfect storm, medically speaking. But it can also be viewed as a possible baseline for how disease can impact an unprotected force. All of the epidemiological components of Walcheren fever still had the potential to be extremely problematic in the Scheldt in 1944, but they were kept in check with aggressive public health measures. Anything else would have led to serious outbreaks of any of these diseases, resulting in mortality, non-effectiveness, and the draining of medical resources. Now, these problems still remain with us today. Modern acute care measures, as I pointed out at the beginning, have advanced to the point where we're very unlikely to ever see the same death rate from disease rivaling that of 1809. But the percentage of troops in an exposed force who can become disease casualties, even if they are non-fatal, today is almost as high as it was in 1809 if preventive medical practices are not put into place rigorously. I'll cite a few examples here. In 1958, the American deployment to Lebanon, U.S. Marines who landed there were plagued by enteric fever, typhoid and paratyphoid, which had been long eliminated from the civilian population, and vaccines existed for it. But largely they were plagued by it because of the lack of preparation and planning for medical support. During the Vietnam War, the U.S. Army suffered an average of 100 battle casualties per 1,000 soldiers in the field per year. But they also suffered 400 disease and non-battle casualties per 1,000 soldiers per year. So almost 4 times as many soldiers were being put in hospital from tropical diseases as were actually being wounded and killed in combat. One of the best examples, though, I think, is the Soviet occupation of Afghanistan in the 1980s. From 1979 to 1989, there were about 600,000 Soviet troops that were deployed there. Only about 2% of them were actually killed in combat, but over 400,000 of them, 88% of the force, were ultimately hospitalized for serious infectious diseases, including 100,000 cases of infected hepatitis, 30,000 cases of typhoid fever, tens of thousands of instances of cholera, typhus, dysentery, diphtheria, malaria, and the Black Plague. All of them stemming from horrible hygiene practices and lack of supervision and inspection. One sick cook who failed to wash his hands after defecating would routinely make an entire regiment sick during the Soviet war in Afghanistan in the 1980s. And there's even more recent examples. In 2003, the Americans deployed, again with the Marines, to Liberia during the Civil War. 44% of the U.S. Marines who were sent to Liberia on that deployment came down with life-threatening falciparum strain of malaria. Lab blood tests showed that only 5% of the troops were taking their mefloquine anti-malarial medication as prescribed. In 2000, Canadian Forces peacekeeping deployment to East Timor. Just under half of Canadian personnel were infected with dengue fever and many others with malaria. Canadian Forces reports indicated that this was because the medically recommended countermeasures which for the most part involves destruction of mosquito habitats, were not being enforced by the commander on the ground. It's particularly telling and embarrassing because other United Nations contingents located near the Canadians in East Timor had much better compliance with the dengue countermeasures and did not experience any major outbreaks. You can even take this one step further, if you'll allow me to. Military medical practitioners 250 years ago knew that centralizing healthcare in hospitals can spread infectious diseases. Leading medical reformers, as I pointed out, of the 18th century, advocated decentralizing disease treatment as much as possible. Now, but we've recently rediscovered many of these perils of centralized healthcare. Diseases caught in care in Canadian hospitals have become one of the leading causes of death in this country. According to a recent Globe and Mail story, 250,000 Canadians catch illnesses in hospital while undergoing unrelated treatment, and between 8,000 and 12,000 die of them every year as a direct result. And with the advent of antibiotic-resistant superbugs, this number is not going to be getting smaller anytime soon. Now, I don't want to belabor that point too much, but you can still see that many of these problems that we're confronting the military continue to plague both the military today and can even be seen in reflections in civil society as well. So what are our lessons for the Walcheren case studies for today's military? First of all, number one, force health protection through hygiene and preventive medicine, including vaccination, rigorous hygiene and sanitation, and other prophylaxis cannot be neglected. Potentially devastating results will occur if they are. Secondly, the lack of proper medical foresight and the absence of medical officers in decision-making process were critical failures on the part of the Walcheren Expedition in 1809. The reverse, medical consultation at all levels of decision-making, were really responsible for some of the conspicuous successes achieved in Scheldt in 1944. Proper medical intelligence and the application of that intelligence is key. Third, the responsibility for the enforcement of health protection really lies with military commanders. In the absence of command responsibility for forces' health, medical expertise will not result in compliance with these vital public health measures by itself. This goes for the enforcement of hygiene standards and ensuring that vaccination and prophylaxis are carried out and are not treated as voluntary in the military force. And finally, disease has been, is, and will remain an important factor in military operations, maybe more so than in the past. In previous centuries, opposing forces on the ground could expect to be affected by disease roughly equally. Not always, but for the most part, they could expect that both of them would be devastated by disease in roughly equal proportion. Today, it's possible for a military force that takes disease control seriously to gain a tremendous edge over one that does not. But likewise, consequences for the breakdown in force health protection practices are magnified. All right. Thank you very much for your attention, and I'll be happy to answer any questions.